Good afternoon, dear audience. Today, my presentation is about infertility, mostly about unexplained infertility problem. Okay. So, briefly, what is female reproductive health? Reproductive health is a state of a mental, physical, and social well-being, and not just merely the absence of infirmity or diseases related to the reproductive system, its anatomy and functioning. It also a condition when a woman is able to have satisfying and safe sexual life, and also is able to reproduce whenever she wants. What are the disorders of female reproductive health? Early or delayed puberty, endometriosis, uterine fibroids, menstrual cycle disorders, polycystic ovary syndrome, complications of pregnancy, and of course infertility or subfertility. What is infertility? It's a failure to conceive within 1 year time for women below 35 years old, or within 6 months for women older than 35 years old. Infertility overall affects around 15 or up to 20% of the couples. It's a worldwide statistics. How was actually designed, or how did they come up with this definition, 1 year of unprotected intercourse? If to consider the month rate or month probability to conceive, which is also was calculated statistically, is around 20%. So cumulative rate of the pregnancy within 12 months is 93%, almost 100. So that is why given 12 months. The most biggest lifetime endowment of the oocyte pool is given to a female offspring, female fetus, in the age of 20 weeks of gestation. So there are 6 to 7 million of oocyte in a female fetus. By the time of the birth, it reduces more than half, only to 3 million. By the puberty is 300,000 only. And considering that each month female human ovary recruits around 30 to 50 oocytes, and only one of them receives a chance to grow to ovulatory follicle, so the rest 25, 45 undergo atresia, the process of atresia, literally become wasted. So that is how drastic is the oocyte decline within the lifetime, woman lifetime. What are the causes of the infertility? 35% it's a male factor. So the rest 65 falls under female factors, which most of them are tuboperitoneal infertility. Then second place, ovulation disorders, and other factors such as immune, endocrine, and so on and so forth, only 5%. Among infertility factors, female category. It's a failure to ovulate due to polycystic ovary syndrome, premature ovarian failure, resistant ovary syndrome, functional hypothalamic amenorrhea, which is also quite common and poorly recognized nowadays, but should be considered, definitely should be considered. Tubal, uterine factor, cervical, peritoneal. Male factors, pretesticular, testicular, and post-testicular, related to congenital or acquired diseases. Factors affecting both sexes in terms of fertility. Environmental, occupational factors, toxic effects such as intake of the drugs, alcohol, nicotine, and so on and so forth. Excessive exercise, calorie deficit, or extreme weight loss, obesity factors, engaged in unprotected sex, and advanced age. What is diagnostics of the infertility or evaluation of the infertility? It includes obtaining the full history, medical history from both male and female, physical examination, lab imaging, and surgical investigations. To obtain the medical history, you should thoroughly to ask your patient about their previous pregnancies and their outcomes, the menstrual function, the male medical history, which is any current medications that they are taking, sexually transmitted diseases, of course. A physical examination, abdominal evaluation, dermatologic, breast, head, neck assessment, blood pressure, pulse rate, and so on and so forth. Lab imaging. So here you should go with the hormonal profile, laparoscopy, or hysterosalpingogram sometimes. And semen analysis, of course, or sperm functional tests, and if needed, transrectal ultrasound for male partner. So unexplained infertility is where it is diagnosed when the couple underwent all the possible tests and there was nothing found. I mean, no abnormalities, no pathology. Unremarkable examination, including or before any surgery. So nowadays, unexplained infertility before doing any surgeries, I mean, such as laparoscopic or hysteroscopy diagnostics, all the findings. And it is diagnosed in 25-30% of all the infertile couples. So also quite significant number. What is it attributed to? Disorders of the thyroid gland, hypo or hyperfunction, mostly hypofunction, obesity, immune system imbalances, deficits of vitamins and minerals, inflammatory lifestyle, which yesterday I mentioned what means the inflammatory lifestyle, and of course, oxidative stress and mitochondrial dysfunction, which leads to low quality of the oocytes and the sperm cells. So what oxidative stress, why it is important when you deal with the problem, as a specialist, when you deal with the problem of infertility in the couple? It literally damages the follicles and endometrium. It impairs implantation. It results in the abnormal steroidogenesis, oocyte maturation, impaired ovulation. It contributes to development of such diseases as PCOS, premature ovarian failure, endometriosis, and also it's a causative factor for pregnancy complications. Where in the female reproductive system, literally where in the follicle, there is a production of reactive oxygen species that causing oxidative stress. In granulosa cells, in the oocytes, in eucumulus cells, and endometrial cells. In oocytes, female cell, germ cell, appear to be vulnerable in terms of the mitochondrial dysfunction and vulnerable to oxidative stress because the amount of mitochondria is the biggest among, compared to other cells in tissue, also almost like in the muscular tissue. And later on, I explain why oocyte has this big mitochondrial reserve, mitochondrial pool. Superoxide, anion, hydrogen peroxide, hydroxyl peroxyl, and hydroperoxyl. It's just some of the mentioned reactive oxygen species that damage or cause the damage of female reproductive system. But at meantime, they play a positive role, means they essential. The production of the reactive oxygen species mediates the process of ovulation, it triggers ovulation. The corpus luteum breakdown, it is important for implantation, for embryo development, for shedding of the endometrial lining during menstrual cycle, also for steroid hormones production and follicle maturation. So we still need in our body the free radicals to be produced, but they should be balanced with the properly working antioxidant system, antioxidant defense. Where majorly in the cell we have the production of reactive oxygen species in the mitochondria. In the mitochondria, during the citric acid cycle, the transport of the ions from NADH to flavin adenosine dinucleotide, it is accompanied with the leakage of the electrons. So that's how the superoxide anion is formed, one of the free radicals, right? But in the presence of superoxide dismutase, in the presence of glutathione peroxidase, important enzymes of the antioxidant defense, it is been neutralized, literally broken down to water, not causing any damage. And in case of weak antioxidant defense, in case of these enzymes deficiency or low production of these enzymes, there is excessive amount of free radicals that can cause lipid peroxidation, protein oxidation, DNA damage, and mitochondrial dysfunction. So it's like a vicious cycle. Mitochondria produce free radicals, and these free radicals damage it at meantime. It leads to disrupted protein function, dysfunctional DNA and mutations, to elevated inflammatory cytokines formation. It destructs oocytes and follicles. It leads to defective implantation, altered endocrine function, and endometrial damage. So what happens in the female reproductive system because of the excessive amount of free radicals production? In the uterus, it is abnormal or maybe even impossible implantation, endometriosis, preeclampsia, abnormal placentation, fetal growth restriction, miscarriage. In the ovaries, it leads to reduced ovarian reserve, impaired folliculogenesis, increased apoptosis, polycystic ovarian disease. In the fallopian tubes, it leads to ciliary dysfunction. So, meaning the transport of the oocyte becomes impossible. So, the natural process of conception also becomes impossible. In the oocyte, it's a DNA fragmentation. It's aneuploidies that it is literally chromosome pathologies, mitochondrial dysfunction, and altered gene expression. The process of oocyte maturation, the first and second meiotic phases, the meiotic divisions, which is happening during ovulation, the first one, and second one during the implantation, requires big amount of energy. That is why oocyte is number two cell in our body that is rich in mitochondria. And during the recruitment process, when the antral primordial follicle grows to antral and pre-ovulatory, the amount of mitochondria increases times from 6,000 to 200,000 mitochondrial DNA. And we all know that the DNA we have not only in the nucleus but also in mitochondria, right? And the DNA that we have in the mitochondria, it has different anatomy. It's a two-stranded circular DNA, the one that does not contain introns and exons. So it appears to be very susceptible or weak for mutations development. It encloses 37 genes, the one that it encode the proteins of the respiratory chain complexes, literally the synthesis of ATP production. So all of them are extremely important for the synthesis of energy in the cell. And if it happens, the damage of the mitochondrial DNA, the enzymes that perform repair of the mitochondrial DNA appear to be insufficient, also leading to excess of the mutations. And it becomes, the mitochondrial dysfunction becomes one of the reasons of the low oocyte quality, same as sperm cells quality. And also in the studies, it was found that oocytes that were unfertilized or oocytes of the advanced aged women, they contain, most of them contain the mutation, common mutation, which you can see on the slide. So around more than 1/3 of this circular DNA, mitochondrial DNA, becomes deleted. So this big mutation leads to totally abnormal synthesis of ATP. How in the world they manage problem of unexplained infertility? If it's less than 2 years of attempts to conceive, and a woman is below 35 years old, they still wait these 2 years, the so-called expectant management. Or they advise to do to practice timed intercourse. After that, if still there is no success, they go do the 6 cycles of ovarian stimulation with gonadotropins, or ovarian stimulation together with intrauterine insemination. After these 6 cycles, if there is no success, they do IVF. In the women older than 35 years old, they do not wait, do not practice expectant management, straight away go to stimulated intrauterine insemination. And women 40 years and above, they do it only 2 cycles and straight away go to IVF. So what happens in the oocytes due to mitochondrial dysfunction? First, it's abnormal, as I said before, oocyte maturation. So, due to impaired nuclear spindle activity and chromosome segregation, because not enough energy from the mitochondria, not enough ATP molecules. That is why it results in the increased rate of aneuploidy, trisomies, Down syndrome, and other chromosome pathologies. Disturbed implantation, as I said, so that is why those women fail to conceive. And arrested, if it even happens, the conception happens, the embryo becomes arrested, cannot develop further, because again, not enough energy. What the modalities exist nowadays to treat or to address the problem of oocytes mitochondrial dysfunction or low quality of the oocytes? First of all, it's the use of antioxidants. Either it's enzymes, glutathione, superoxide dismutase, catalase, either it's a coenzyme, Q10, folic acid, vitamins, pantothenic acid, melatonin, resveratrol. They also use enrichment of in vitro fertilization culture, where they merge egg and sperm cell. They use conditioned medium with listed above antioxidants. Another option is to use mitochondrial peptides to restore mitochondrial function, literally, in anatomy. Another option is the use of immunogenic stem cells that help to reduce inflammation in the body and oxidative stress, such as placenta-derived cells, thymic progenitor cells, bone marrow-derived. Another option is to use intrauterine administration of allogenic mesenchymal stem cells, the one that were co-cultured with the media with human chorionic gonadotropin. Another option is mitochondrial substitution therapies, when from the same person, which is donor and recipient, they harvest mitochondria from other stem cells of the ovary and administer those harvested mitochondria, administer or insert it in the oocyte, enriching the mitochondrial fraction. Another option is to transfer the chromosomes from oocyte of the donor attached to the meiotic spindle, so it's already half matured oocyte. The chromosomes extracted and insert in the donor's oocytes of the recipient. So literally inserting in the rich in mitochondria's media for them to grow. The mitochondrial peptides or organ-specific stem cells of the hypothalamus pituitary adrenal gonadal axis also appear to be quite beneficial. Pituitary gland, adrenal glands, liver, ovaries, and testes, also hypothalamus, placenta, and thymus. This is our experience of treatment of infertility in male and female. Vitamin D also appears to be essential for women who would like to conceive. And also in the studies, it was proven that it improves pregnancy outcomes and increase the chances to conceive. In women with polycystic ovary syndrome, which is one of the main causes of the infertility due to anovulation, it appears to be extremely important because it works anti-inflammatory, it's able to reduce insulin resistance and increase the production of the progesterone, increasing the chances to conceive. So the target level of the vitamin D for those women should be 40-50 nanogram per milliliter. In male, it also improves the sperm production and the motility of sperm cells due to improvement of steroidogenesis. This is our very own publication, quite recent, me and Dr. Dmitro Kokol, on unexplained infertility, where you can more detailed to get the information about the unexplained infertility and how you can address this problem. Thank you so much.